So, hello everyone, myself Punjal Chandrakar. We have with us here Dr. Anujith Kumar, Professor, Manipal Institute of Regenerative Medicine, Mahe, Bangalore. A very, very warm welcome to you to Treat DM, sir.
Thank you very much.
So, looking at the regenerative medicine approaches, what do you think is the current state of generating functional insulin secreting cells from stem cells?
There is advancement in technology, that's for sure. And across the globe, I think if you look at it, the induced pluripotent stem cells has been differentiated into functional beta cells. Some of the protocols which has been available, to mention few, for example, from the Douglas Melton's lab, there is a monohormonal glucose responsive beta cells which has been generated, and probably the clinical trial has been started. The beta cells which has been generated from the stem cells, the clinical trial has been started. And I think so just we have to wait for some more time to really know that, okay, to what extent it is successful.
Yeah. Continuing on the similar lines, what do you think are the major physiological hurdles in translating these approaches to a clinical setup?
One of the major drawback is, for example, if you are going for a translational approach, it is immune surveillance. To what extent the body immune system is able to take the cells what you receive after differentiation. That's one of the thing. And second thing is undifferentiated counterpart. So when you're taking the stem cells and differentiating them into the beta cells, I won't say that you get 100 stem cells getting differentiated into 100 beta cells. That's not the case over here. So what is the contribution of these undifferentiated stem cells towards your body's response? Will they form the tumor, or will they take more time in an in vivo situation to mature further into the beta cells? Those are the questions still, I think so, are the hurdles, if I have to say it.
So, since we are in Treat DM, how effective do you think platforms like Treat DM are in fostering a collaborative approach towards advanced healthcare and research?
Yeah, coming to this thing, I think so it is a great job by the Treat DM, no doubt in that, because very few conferences are taking place where the amalgamation of the clinicians as well as the basic research scientists are going hand in hand. Because it is either basic science research or somewhere only the clinicians are making the conference. This is one of the such things where the conclave of both clinicians as well as the basic research people, they are coming together. Hopefully, this amalgamation works, and what the researcher wants, the clinicians are able to provide, and what clinicians wants. Probably basic science works like that. When you go for a translational research, at least it goes what the clinicians want. Then only I think so a basic research person can formulate it what clinician wants.
Definitely.
In that way, I think so Treat DM has done an excellent job, no doubt.
Definitely. So, lastly, what advice would you offer to young scientists and clinicians who aim to bridge fundamental discoveries and practical therapies in metabolic disease research?
Okay. To young scientists, coming to the first point is, please get into the research if you have passion. Unless and until you don't have the passion, because this research thing, you have thousands of hurdles. Okay. Day-to-day experience, what we are talking about. Yes. First thing is passion. And coming to the translational research as well as with respect to the basic metabolic disorder, if you're asking that question, yes, the young scientist to get into, I'm not telling get into just metabolic part, or try to get as much as the translational research. I think so keep it as one of the pioneering thing. That's what I would like to say. So please think of translational, what is the human society is benefiting, okay, whatever the research you do. Because whatever the grant money what we get, because my guide also used to tell that, we are utilizing the taxpayers' money here. So when we are utilizing the taxpayers' money, obviously it has to go back to the society. So try to do as much as translational research.
Right. Thank you very much, sir, for your precious time and valuable insight. I really enjoyed our conversation.
Thank you very much.
Thank you.